That story out because, a lot of people, the cases have been coming down, have been thinking that India is out of the woods as far as the second wave of coronavirus is concerned. But we are already under the threat of a third wave, which could be triggered by the Delta Plus variant, which is now a real concern in India. The government has already notified states as far as the Delta Plus variant is concerned. It is being now seen as a virus of concern. How much of a threat is this variant? Milan Sharma files this report.
Delta Plus, the new variant of coronavirus, is spreading slowly in India. 21 cases of Delta Plus have been detected in Maharashtra. The state government says 9 cases are from Ratnagiri, 7 from Jalgaon, 2 from Mumbai and 1 each from Palghar and Sindhudurg Thane. Cases are also detected in Madhya Pradesh, Karnataka and Kerala. So far, over 40 cases have been reported. The centre has asked the 3 states to be on alert.
आज स्वास्थ्य मंत्रालय ने इन राज्यों को एक एडवाइजरी जारी करके ये बताया है What is the kind of public health response that Maharashtra, Madhya Pradesh and Kerala should initiate, which presently looks fairly small in terms of number. But we would not want this to assume significant proportion.
The Delta variant had triggered the second wave that stretched India's health infrastructure to the limits. The fear is that latest variant could evade immunity induced by vaccines and previous infection.
This virus can infect people and can be responsible for the third wave. So it has to be the totally a social responsibility to prevent this third wave from the Delta Plus.
India could perhaps learn from the UK experience. A new study from Public Health England shows that Pfizer-BioNTech vaccine was 88% effective in preventing symptomatic disease due to Delta in fully vaccinated people. But the fear is that AstraZeneca vaccine provided slightly less protection. 2 shots were 60% effective against the variant. But there are concerns as well. From February 1 to June 14, 73 deaths were reported in Britain owing to Delta variant. 34 of them weren't vaccinated. 11 had received 1 dose of COVID vaccine. 26 had received both shots.
Scientists are still working to understand this virus, and particularly now with these mutating viruses. And for safety, the only weapon we have is vaccination. AstraZeneca is equivalent to COVID Shield of India. It is definitely effective, almost 80 to 90% if you had both the doses of this vaccine.
As of Wednesday, there are over 200 known cases of Delta Plus variant. United States and United Kingdom have more than half of them.
With the Delta Plus variant, the immediate question is, could it be a contributing factor to the impending third wave in India? Experts believe that one should move on precedents because even though the Delta variant, the parent variant, was seen in India in a few cases in December 2020, emerging evidence shows that it was the one that wreaked havoc across the country in the second wave of COVID-19. Right now, more sequencing will need to be done from each and every district where the Delta Plus is being reported from. With Dinesh Lal in New Delhi, this is Milan Sharma for India Today.
All right, so what all do we know about this Delta Plus variant, which is a huge cause of concern as far as the experts are concerned? What all do we know so far? It is a mutant of the Delta variant, which was first detected in Europe in March and classified as a variant of concern, more virulent than the Delta variant, which was the major cause of the second wave of coronavirus, a crippling second wave of coronavirus in the country just a few weeks back. This is less transmissible than the Delta variant, but at this point of time, the Delta Plus variant is a variant of high concern. as far as the government of India is concerned. Now, where are the known cases so far in India? The government of India has notified Maharashtra. Overall, 40 cases of Delta Plus variant have been identified in the country so far. Maharashtra has about 21 cases. We'll also give you a kind of a breakup of where all these cases are coming from in Maharashtra. So if you look at the breakup, Ratnagiri, Jalgaon, these are Palghar, largely rural Maharashtra. Few cases in Mumbai as well. Sindhurg, Thane also have one cases each. But apart from Maharashtra, there are cases which have been reported in the state of Kerala. There are cases have also been reported in the state of Andhra Pradesh. So all these states are now on high alert as far as the Delta variant is concerned. All right, ladies and gentlemen, with that, we are slipping into a very short break. On the other side, global tourism sector is witnessing some sort